So thank you all for joining. Let's see. Perfect. So just as I said, I kind of want to check in with all of you. Make sure that we have publicity coordinators, and I know several of you are, so appreciate you joining. I want to hear kind of what each site is already doing for their publicity efforts, what you've already started, maybe what you're still planning to do. I want to make sure that everyone has been into the volunteer management system and found all of the necessary resources. I did put some customized flyers on there, so I want to make sure everyone saw it, and a few of you have already reached out for more customizations, so I always appreciate helping, so thank you for not hesitating to reach out. And then I kind of want to know how else we can support you. And we'll be going through a few different ways and a few different strategies that we should be focusing on currently. But I kind of want to check in with each of you. Does anyone want to let me know kind of what they've done and kind of where you're going from here and what we've discussed on previous publicity efforts?
I can start. I'm Tammy Sullivan. I'm with Lamar Street Center. We're one of the Arvada health fairs. And,
Hey, Tammy.
I do have Pat, Bobby's husband, is helping with some of the newspaper articles. Wonderful. And then I have a publicity coordinator, Rebecca. She may or may not jump on. She was having some computer issues when I spoke with her earlier today.
I can relate.
Yes, yeah. So her and I have both already started kind of just online on our website and then on Facebook, posting and inviting people. And I think we're down to just needing 4 or 5 volunteers. So we're really close to having all of our volunteers in place.
Right on.
And then just sent the link out to everybody for signing up. I don't know, the last time I looked, I couldn't see how many people had went to sign up online.
For volunteering or for online registration?
For online registration.
Okay. I actually have those numbers and I can let you know how many folks have registered online for your fair. Let me see. Lamar, you currently have 16 folks registered online.
Okay.
Yeah.
So yeah, we'll keep trying to push that link out. I was also sending it to all of the volunteers to make sure that they sign up online if they're going to get their blood drawn. Because in the past, it seems like they all just come to the fair and have it drawn, and some of them look for those vouchers.
Right.
We won't have those this year.
Right.
I did let everybody know, go ahead and get on there.
Perfect. And we'll definitely touch on kind of volunteer and involvement a little bit more in this webinar too. So I like that you're already kind of reaching out and making sure they know what benefits are there for them as well. It's awesome. And I did just so everyone.
Thing that, oh, sorry.
No, go ahead. Go ahead.
Another thing that Rebecca's doing is reaching out to all of the local churches. So historically, we have done a lot of kid like backpack programs and schools, and we're not doing any of that this year. We're just reaching out more to the churches.
Very cool. Well, it sounds like you definitely have a great start, and we'll definitely be able to kind of build on those efforts. And I was actually just talking with Pat earlier today, and one of our communication staff at Virginia actually found a place for some free media, free earned placement. So I will be sharing that with you all in an email on Thursday that'll go out with the nuts and bolts. But for that first Arvada Covenant Fair, I made sure that they had it. So since it's like a week and a half away, but you all will get that information on Thursday in the nuts and bolts. So look out for that. Okay. Is there anyone else that wants to share kind of where you are and where you want to go, Cruz?
Yes, I know my name is Cruz, but this is Michelle McCollum. I'm using my son's Chromebook for virtual learning, and I can't figure out how to change my name.
That's awesome. I think I did that last time too. My apologies.
No, it's fine. So I am site coordinator for the Alma Fair, and this is their first site. So I know it's bad of me to not have appointed a media person as of yet, and part of it is because it is a new fair. I don't want to let anything fall through the cracks.
Sure.
So I, and I've grown up in the area, so I have, I did work at the Eastridge Center, so I do have an Eastridge Instagram. So I've been posting things there, but it's not, necessarily reaching the Alma area. I've just been posting, registration and things like that. But I do have access to probably 5 local Facebook pages for Summit County, Park County, Chaffey County that I've been
Great.
Yeah, the online. So it has a wide audience, and Town of Alma Facebook page. So I've been posting for Volunteers Needed, as well as the registration for the upcoming event itself. I also sent an email to the editor of the local town newspaper. And I did see that they had posted an article that the 9 Fair was canceled back in April. So I thought, for Bailey, so I thought this was great that we should let them know that Bailey's on as well as Alma. So, sorry, dogs are doing stuff. And so I wanted to let them know about that. And then I saw your email come over today for tonight's event, and so that inspired me to reach out to the churches. So I went and found all the local churches in South Park as well as Breckenridge, and got all the emails from local pastors, as well as the South Park Senior Center and community centers, and let them know about the event. And so I am really almost full for my volunteers. I have 3 EMT crews coming, as well as the nursing school for Colorado Mountain College. And I posted on my personal Facebook because I worked at St. Anthony's here locally, so I have a few volunteers coming from Denver. And I'm 4 weeks out, so I'm feeling pretty ahead of the game. And then as of today, I have 9 participants registering.
Awesome. Yeah, that sounds like you're definitely doing a lot of efforts. Do you have anyone assisting? I know you don't have a specific publicity coordinator, but do you have anyone assisting you in the area?
So Edith will be there, but there's also my daughter was an MA for UC Health. And so she was coming up to volunteer as a phlebotomist, but I think I'm going to move her to non-medical assistant.
That's awesome.
Just because she's organized and she was a liaison for UC Health, and somebody that I personally know that I can depend on.
Always key. Well, I'll let you handle the pups for a little bit.
Good timing. So that's but yeah. So now I just want to get some more ideas for the timing. Yeah. Okay. I think I should stop now.
Take care of those pups. Would anyone else like to go from another site?
I can dovetail in. This is Marianne Waslowski, and we are the Bailey site at the high school. Mm-hmm. And Michelle, I'm so happy to meet you online because I think we should coordinate Park County outreach for this. And so let's make sure we can exchange contact information on that. That would be great. The article in the Flume was placed by Charlotte R. Lead, and we have more planned. So I think you were referencing the Flume, and we'd love to be able to partner with you on that community engagement for Park County. Yeah. Between with the Bailey and the Alma both being there.
And I can even create customized flyers for both of those Park County fairs. I've done the same thing for the Arvada fairs, and you'll see that later in this presentation, but I'm happy to kind of create something that coordinates both of those fairs.
Okay, great, thank you. So we have we put something in the Flume last week. We plan to put something in a week from now. It comes out once a week. It is the newspaper for our mountain communities up here. we share the flume amongst pretty much all of Park County. And then we also had a flyer developed by our media person. We've got a graphics person here in Bailey that has stepped forward to be our publicity person, and she's doing a great job. And so again, we'll share with you, Michelle, some of that. So we've done that so far. We've put it out on our email list between the Rotary and the Senior Alliance of Platte Canyon, who are helping to bring all the volunteers together. It's interesting up here, and I don't know if it's the same in some of the other rural areas, but we have like 7 or 8 different social media sites that are local. So you can't reach everybody with just one. We do have Pine Cam, which is the 285 corridor, and that tends to be a big outreach right there. But that also reach, and that's fine because it'll reach Conifer and that kind of thing. But as far as our area for Grant, Shawnee, and Bailey, these more rural areas, we have like just little, almost HOA social, social media accounts. So we will be compiling all of those together to do our outreach.
Wonderful. And is that just on social, or do you plan on reaching out with them like physically with a flyer or somewhere they can like share it with their email lists or on a bulletin?
Well, the flyer will be attached, they can share. So they
Cool.
can share all that. Yeah, is that what you're asking?
Yeah, it is.
Because interaction wise, there really isn't that much up here. I mean, some of the restaurants are open, but otherwise we don't have a incorporated area. We don't have, the churches actually are really low on their attendance right now. So we were thinking actually the backpack program electronically, send the flyer out so that it actually gets read. Because I mean, as a parent of 4, and I know that not everything else gets read in a backpack. So, so that said, we're just thinking outreach through schools, outreach through the social media sites, the newspaper, and our Chamber of Commerce also has
Wonderful.
pledge support.
Wonderful.
And Marianne, I did not post on the 285 Morrison page because I know a lot of people like that to be only about traffic through the Conifer Bailey area.
Yeah, there's a lot of stuff going down on 285.
I know, and I didn't want to get yelled at, but
yeah, they would turn it into they're taking the stoplight away. Yeah.
okay. But there's a lot of people on that page, and I don't know.
No, I get it. They didn't all get the rabies shots. I get it. But,
Yeah, but I did get information on the South Park Bulletin page that Chaffee County is running out of flu shots.
Oh.
So, because there was discussion that everyone said we need to open the discussion about flu shots, and they were posting the flyer through Alma there, and people are saying that Chaffee County is starting to run out of flu shots already. So, heads up that for everybody that is a discussion going on right now.
And can I just add one more thing? I know you've got a lot to go through here, but will there be any communication that is advertising the fact that this of any year, this is the most important year to get a flu shot? Will that be part of the media?
I think it can definitely, I believe that our communications department will be touching on the importance of the flu shot, because I know a lot of counties, when we were originally setting up and getting county approval for these sites, they were very excited about the fact that we were going to do flu shots through Safeway Albertsons. So yes, I will say that they will do that. And I will also encourage all of you to really put an emphasis on that in your outreach as well, and making sure people know it's while supplies last. So we will have So we will have the free flu shots or the vouchers, whichever they choose there, but it is while supplies last. But it's definitely something that we want to be really pushing out.
And so should we look to you for that kind of the publicity, or do you want us to create our own while we're waiting, or can you just let me know which way you want us to go with that?
Yeah, I will go ahead and confer with the communications department, but I believe if you go ahead and get started on doing that, it would definitely be beneficial. And if you want, you can kind of let me know what you're doing and I can give any like suggestions or things like that. But definitely, if you want to take ownership of that for that area and others, we can share that. I think that would be a great idea. And then quickly, I did want to touch on the school outreach, just being super careful with that because we don't want kids at the fairs. So making sure that that's just known for parents and things like that.
Okay.
We
Got it.
Yeah, we kind of don't want a lot of kids there just because of the liability, and we won't have those kid zones this year.
Okay, no kids. Got it. Yep.
Yeah.
And then I have one more thing about that. Oh, the flu shot. Will it be the 3-dose or the 5, like the 3 strain or the 5? Do you know, or will there be a choice for the people that are over the age of 65?
I don't know. I will get back to you on that.
Okay, great. Thank you.
I'm sure Edith or Melanie knows, so I will ask.
Okay, thank you.
Write that down really
Just
quick.
because we have a lot of seniors in our area who are probably going to want to know.
Perfect.
I'm done. I didn't want to hijack.
No, you're totally fine, Marianne. Does anyone else want to go before we move on? Perfect. So, perfect. So I do have, I just want to, and it sounds like everyone's kind of really doing this, kind of putting out there that online registration is open. I did create a few of these, and the one off to the far right is an example of a combined one that I created for the Arvada fairs to put out. And these are really great for community calendars or newsletters, or if like the Chamber of Commerce is putting something out, these are really great for a small placement, even for like the Flume or something like that. Just making sure that you, in every messaging that you put out there, we're saying the safety procedures, because not all the flyers I create and all the images I create have everything incorporated. So I just want to make sure that in everything that we're doing, we're assuring the public that it's safe, that we have these safety measures in place, that we coordinated with all the counties, we're going by the CDC standards and the state standards. So just making sure we're really making folks comfortable in attending the fair, and they know that they're going to be safe while doing so. And just the required appointments. And we know that we will be allowing some folks to register on site, but we definitely want to make that kind of more the exception. Like they call us and be like, oh, I don't have an email, I don't have a computer. Well, we'll make an exception for you. Go ahead and show up and we'll be able to register you online. Sorry, I cannot talk tonight. But really making sure that we kind of put an emphasis on that. And I'm happy to, again, customize any of these things. So just let me know if you do want something like this customized. So a lot of you are already doing these efforts that we're going to chat about, but I think we can take an even deeper dive into these efforts and more of that grassroots efforts. So you're already reaching out to churches and Chamber of Commerce, it sounds like, and schools and libraries, just making sure, like even places like Starbucks, I know some of the more rural sites don't necessarily have a Starbucks in the area, but even just local coffee shops or just local restaurants. You said a few of those are open. A lot of the times they do have these bulletins, or they're willing to kind of put a flyer there on the counter for when people are like, say, buying a Red Bull or something at the gas station, and they see that flyer when they walk up, and they can be like, oh, 9 Health Fair, I can do that. You know, it might not be as targeted, but it will be targeted to that area. So thinking of those little random places where we can bring in a paper flyer and put it up somewhere for people to just see as they're passing by. Whether it's a rec center or even like local newsletters. And it sounds like a few of you are already doing this. Just making sure we're being consistent about it. It often takes several impressions of people seeing something for them to register it and then act upon it. So I'm just making sure we're being super repetitive and making sure we're getting all of the places so that we're reaching all of the people. And a lot of this will just take a little legwork, but it sounds like a lot of you are already doing those motions and kind of getting into it. So just adding a few of the places, even, you know, local businesses like a grocery store or something like that in their break room for their employees, go ahead and putting a flyer up there, because a lot of these folks might not have good access to health insurance or something like that. And those are really our target people that we want to reach. So kind of going to those places of business and going to those grocery stores and restaurants and kind of making sure that we put a paper flyer up there, or even just coordinating with supervisors or something like that to put it into an email to staff, or maybe they have a virtual private social media group or something like that where they can put it in there so folks can see. Kind of just like the more places we can put it, the better. That way folks continually see it. And this kind of goes on that as well. It's just a little bit kind of what I was just saying. But really, I want you guys also to make sure that we're posting things on Nextdoor. And I'm happy to kind of come up with some copy for that as well. I know that we'll be doing a big push for our staff to do this as well. So just encouraging different people in your area on your team to be posting things on Nextdoor, because that is really targeted geographically, and that'll get to those HOAs and those people in those neighborhoods who maybe aren't on social media, but they like to keep up with what's going on in their neighborhood. And it's a community fair run by the community, so that really reaches folks. So I really encourage people to be posting on Nextdoor weekly. I think that will definitely reach a lot of folks. And kind of just, again, more targeted to that geographical area. Are there any questions on that? I know a lot of you are already doing a lot of these grassroots efforts. Is there any questions on like how to do it just a little bit more aggressively with some of these paper flyers and getting into break rooms and things like that, and how to approach folks?
I have a question about
Sure.
the logo, because I see the 9 Health Fair logo, and then in the package online, there was a 9 Health logo. So which is the logo for the event?
Yeah, so really for the 9 Health Fair, it can be that 9 Health Fair logo that I have on the top here. 9 Health is our overarching brand, so neither one of them are wrong. I'm happy to supply both. A lot of, potentially even rural communities know us better at 9 Health Fair. So when I'm marketing these fairs, I tend to use the 9 Health Fair logo a little bit more. But we do use the 9 Health logo sometimes with these fairs, just because it is the overarching brand for the organization.
Okay, thanks.
Yeah, I hope that answered your question. So these are a couple flyers, and again, on the right here, this is another half sheet that I created for the Arvada fairs. So if you do want something like this to kind of put up, I'm happy, again, to customize that. And I hope you all saw the flyer on the left here on BMS. It really goes into what specific screenings are offered, that free flu shot, again, making sure folks know that it's while supplies last, and really making sure that they get to that. And I do have the social distancing and the face masks here, so just making sure and all of the things that we're putting that in there, whether we're creating it or you're creating it, just making sure that it kind of is seamless and everything kind of looks similar. Does that make sense? So, and a couple of you touched on this, and I think there's even more that we can do to get our Day of volunteers involved in reaching the community. So first, when we are directing them to register for the fair to get their own blood screenings, making sure they're using that Thank You Vol 20 so they can get their 20% off, because we definitely want to thank them for supporting the fair and supporting their community in their quest for better health. So I want to make sure that folks are getting that. And even if you guys have friends or family, we do have that friends or family discount as well. I think it's friends and family. I think that's literally a discount code, but I'll be sure to put that in the newsletter on Thursday as well. Just so we're letting our closest friends know and things like that, so they can get that discount as well. We want to make sure that everyone can get access to these screenings. And again, I know that we're all using our leadership teams to kind of get the word out, but I think giving our Day of volunteers this information as well, and these flyers as well, to spread, to post on their Facebook page, to post in their Nextdoor, because they are ultimately the face of the fairs. Every time I meet a new person who's been going to 9 Health Fair for years, one of the first things they talk about are the volunteers and how they make the experience what it is. And I just think their passion really levels to that. And I think obviously you guys have passion as well, but I think the more people we can get to spread the word about this, the better. So just making sure we're really incorporating our Day of volunteers. And I think that also will kind of help them feel more involved in the process as as well, and not just showing up one day, volunteering, and it's over. Really making them a part of that process to make their fair successful and to have the greatest impact of their community. I think that's a really strong pull, and I think a lot of participants are like, oh, you know, Nancy down the street is volunteering. I'm going to go see her and I'm going to get blood work done. It just kind of puts, again, that little personal touch on it. So I really, really encourage you to kind of reach out to your day of volunteers to get the word of that as well. And then again, just reminding participants at all turn of what we're doing, what 9 Health Fair can offer them. So letting them know about the lab screenings, and of course, making sure they know as well that these normal free health screenings that we have at all of our previous health fairs will not be available, making sure that no one's surprised when they get to the fair that day and they're expecting, you know, oh, I got an eye screening last time or a dental screening last time, and just making sure they know that it's not available and why it's not available, and ensuring they know as well that we still have the 9 Health Neighbors hotline that they can reach out to, not only with questions about the results, but just different questions as well, whether ranging from, you know, dental or mental health or anything like that. And we also have online resources for them as well. So I can also share that in the newsletter on Thursday, making sure that you're sharing that with your community as well while you're publicizing this fair, so that way they can get further development of those health screenings, both in person and virtually. So we're really getting that well-rounded experience. And of course, colon cancer screenings, very popular right now. I'm sure we all know why. And we've actually seen a huge uptick in our participants ordering colon cancer screening kits. So making sure that we're really putting that out there. It's, you know, it's never a good time, or it's always a good time to get cancer screening, but right now people are really thinking about it and it's really top of mind. So making sure we're capitalizing on that and making sure folks know, hey, this is a really easy way. It's $40. You can get it sent to your home, send it back, and there you go. It's super easy. Some folks are even just ordering that and getting it sent to their home. So just making sure that folks know about that. We've already talked about the free flu shots and vouchers. And again, that asterisk is to mean while supplies last. So making sure you're letting folks know that. Of course, the COVID antibody test, some folks want it, some folks don't. Totally up to them. It is the most expensive screening at $79. So a lot of folks, that kind of deters them a little bit, but still making sure that people are aware if they do want to know if, you know, it was just a cold they had back in March, or if they actually have the antibodies. And then they can chat with one of our 9 Health medical neighbors on their results and what that means if they do have antibodies. Because I know there's a lot of misinformation out there about it. So just making sure folks know that's aware, that's available. And then the personalized results dashboard. So that is, I believe we called it a different name in the past. So now they're calling it the personalized results dashboard. So making sure they know that, making sure they know the benefits of that, making sure they know that they can track their health through the years, and that this is a lifelong journey to own your health and to keep on top of it, and to know your risk factors for those chronic diseases, not even just during a pandemic, which of course is important, but always. So making sure that they know that they can do that, and they know that they can take real ownership of their health by seeing those trend lines. Is there any questions on kind of what we're offering them at fairs and the benefits or anything like that? Wonderful. So that's it. That's awesome. That's all we have. But I'm happy to answer more questions on timing or anything like that. We will be sending out more publicity nudges. So there will be publicity information in the newsletter on Thursday. And then we'll be sending out 2 more publicity nudges, making sure, 2 weeks before your fair, you're putting up the banner, you're putting up the coming soon signs, making sure, at the end, if online registration isn't as high as we want, making sure that we're putting out those local pushes, and making sure maybe we're creating video, maybe we're creating, getting all our day of volunteers or our site leadership together, taking a photo with the masks and things like that to create excitement for that. So we will watch that with you, and we will make sure that we're kind of letting you guys know where we are with that and what more efforts can be employed kind of 2 weeks before the fair, a week before the fair, as we're getting closer, so we can support you. Are there any other, I know we discussed a lot at the beginning. Are there any other questions as far as what you're doing, what we should be doing, how we can support you? Wonderful. That means I did my job, I hope. Awesome. Well, thank you all for joining. I really appreciate the discussion and all the efforts that you're already doing. You guys are on it and you're making real progress, which is amazing. And I think the more that we can share with people, the more they'll be motivated to sign up online. So keep going at it, and please don't hesitate to reach out to us for further assistance, because I'm always happy to help.